Lab animal management clinical task for the mouse. Task number 1, performing and/or supervising basic health care procedures of mice, including watering, feeding, handling, identification, and nutritional needs and diet. I'm going to discuss these items. Watering mice. Fresh water needs to be provided for mice all the time. That can be delivered through a bottle tube feeding system. It needs to not be, the bottle needs to not be plastic, and the tube, the stopper in the tube needs to not be of a rubber material because the mice can chew through that. Mice can typically drink somewhere around 15 milliliters per 100 grams of body weight in a day's time. Feeding a mouse. Different species will have different feeding requirements. There are commercial feeds available, pelleted feeds, and seeds may be offered as well. Those pelleted feeds are hard and they help keep the incisors from overgrowing, which is a problem with mice. Some powdered feeds are available as well and are used in a laboratory setting. Handling mice. Mice are very quick, and it takes a little bit of practice in order to handle them efficiently and pick them up. They should be picked up by the base of the tail. If you pick a mouse up in the middle or the end of the tail, you could actually slough the skin off of the tail, exposing the vertebra. That is not advised. You can also, once you've picked them up, you can grasp them by grasping the loose skin over their back and holding them for restraining them for injections. We demonstrated that with a live mouse previously. You can also use a rubber tongued forceps in order to grasp them as well. Mice can tend to bite. Pet mice, if they're handled frequently, the biting should be minimized. Identification. Temporary identification of a mouse can be done with non-toxic markers. Other systems, a numbering system can be used, which is ear punching or notching. And then a microchip can be used as well, and then an electronic device to scan that to confirm identification. Of course, cage cards and those types of things can be used in a laboratory setting. Nutritional needs and diet. Talked about a commercial rodent chow is available. That rodent chow should be at least 14% protein, more during pregnancy and lactating for the female. That it can be delivered through a hopper system, which can be on the lid, or hang inside the cage as well. Coprophagia is important. That is where they will eat their feces. Reproduction. Reproduction in the mice. Mice are continuously polyestrous. They reach puberty around 6 weeks of age, but different strains have different time frames, but average is 35 days. Estrus is 9 to 20 hours. And there is a postpartum estrus, which is 14 to 28 hours after they deliver their litter. Gestation is 19 to 21 days. Average litter size 7 to 11, with the average being 10 to 12. They typically will wean their pups at 18 to 21 days. Estrus. I'm going to talk a little bit more about estrus. If a male is not housed with the females, they will become anestrus. And if a male is introduced, or even an odor of a male is introduced, the females will begin estrus within 3 days, and that is called the Bruce effect. Likewise, if females are pregnant and a male is introduced, or the odor of a male is introduced, the females can actually abort that litter and go back into estrus.